health insurance for the basic level of coverage. The payment for the National Insurance Institute is depending on the salary, but it's between 3% to 5% monthly. And unemployed people need to pay for the National Insurance Institute. It's about $40 per month. There are 4 health plans in Israel. Every resident can choose one of the 4 health plans, regardless of age of health state. The plans provide an identical basic basket of services as required by law, but the availability of the services may be different depending on the location. These include doctor visits, diagnostic and laboratory services, hospitalizations, birth, and so on. It's possible to purchase supplementary insurance for the health plan in order to receive more wider coverage. Okay, this is one thing that I think it's very different in Israel. In the beginning of the last century, there were in Israel a high neonatal and parturient morbidity and mortality. The causes were, I think, the most important cause was the deficiency in medical services. There is an important woman, the name is Henrietta Sold. She was the founder of at the Hadassah Medical Center for my hospital. And in 1921, she created the Well Baby Clinic in Jerusalem. It was the first Well Baby Clinic. And today it's very, I will speak what's the situation today. The aim was to improve medical treatment, mainly to babies and education, and it was given by nurses from the Hadassah Hospital. These are some of the historical pictures at the beginning. The well-based clinics today, it's a system of clinics that provide community public health, primarily to infants and toddlers. The administration is by district health offices, and they are staffed mainly by public health nurses, and additional staff include physicians, nutritionists, health consultants, and social workers. The aims of these clinics include vaccinations, routine developments and growth checkups, prevention of health problems in the community, education, mainly education and prevention. This is the main point of these well-baby clinics. And consultation and referral to additional diagnosis if it's necessary. The other point is they give services for pregnant women, for routine development and checkups, information, consultation, education, but prevention for a woman in pregnancy. Okay, the next topic will be about quality of life. What is the definition? And I will introduce myself in the field of my main research and clinical practice, that is in cystic fibrosis. What is quality of life? Quality of life is defined as the impact of disease and treatment on disability and daily functioning. Quality of life is one of the most important aspects of information that patients with life-limiting conditions and caregivers frequently want to discuss, because the goal of all treatment is to reduce adverse symptoms, to promote the daily functioning as comfortable as possible. In this research published 3 years ago, the purpose of the authors was to examine information that parents from children with life-limiting conditions want to discuss with the children's physicians. A study design included 266 parents of patients, but the most important thing are that the conclusions in children with life-limiting conditions, quality of life is the most frequently desired information that parents would like to receive from the physicians. And I think it's a very important thing. And why I choose to speak about my research in cystic fibrosis? Well, first of all, because I spent most of my time the last years in this field, but I think that it's because CF is the most common serious genetic disease, and previously patients were died in early infancy. Now they live more and more, and we know now that we want not only to provide better survival, but we want to improve their quality of life. Okay, the last topic for today will be about new therapies in the field of CF. This is the median survival of patients with CF, and you can see that now the estimated is more for patients born in 2000. The estimation is of survival for more than 50 years.